Dear colleagues, I'm Dr. Taner Yılmaz from Hacettepe University Hospital, Ankara, Turkey. I'd like to talk to you about voice feminization. Let me give you some basic information on voice femininity. Male voice changes between 90 to 150 hertz, whereas the female voice ranges between 190 to 250 hertz. Between 150 and 190, we call this gender ambiguous range, where the person can be called female or male. 50 to 60% of femininity is determined by the pitch of voice or the fundamental frequency of voice. In order for the person to be called female, you should go above 190 hertz. If it is below 190, sometimes these people will be called gentlemen on the phone and they won't be satisfied. In order to increase voice pitch during surgery, we can decrease length and mass of the vocal folds and increase tension and stiffness of vocal. Surgically, we can control these four parameters. You can decrease subglottal pressure, but you can't do this through surgery. You can do this only through voice therapy or respiratory therapy. The most commonly performed surgical procedure for voice feminization is thyroplasty type 4 or cricothyroid approximation. Cricoid and thyroid cartilages are sutured together with 4 horizontal matrices O proline sutures. By this way, you close the cricothyroid membrane and the vocal folds are lengthened and tensed. During this surgery, Adam's apple or thyroid notch becomes more prominent, so you can combine thyroid chondroplasty or thyroid shave. Satisfaction level, it changes between 55 to 79%, but usually such high figures are not possible. Usually around 30% patient satisfaction rate is acceptable according to my experience. During this surgery, which can be done under local or general anesthesia, there is an external skin incision. You expose thyroid and cricoid cartilages. You pierce the thyroid cartilage below vocal fold level, and you wrap the suture around the cricoid cartilage. You don't pierce the cricoid cartilage as shown in this picture, and tie the sutures on the silicone bolsters on thyroid cartilage. By this way, you are elevating the anterior lamina of the cricoid cartilage, and this displaces the posterior lamina posteriorly, which lengthens the vocal folds and tenses. Early results are usually good, satisfactory. However, in time, this soft tissue, vocal fold, loses its tension, and the pitch increment is lost over time. So the result is not permanent.
Ben 18 yaşındayım.
18-year-old girl,
Şu anda
she has
çalışmıyorum. Okuldan daha yeni
andropneumonia
mezun oldum.
because of polycystic ovarian syndrome, and she has male-like voice.
Müzik dinlerim.
I will perform cricothyroid approximation on her. Thyroid cartilage exposed, cricoid cartilage exposed, cricothyroid membrane exposed. Now I will determine the vocal fold level and pass 4 proline sutures below the vocal fold level through the thyroid cartilage around the cricoid cartilage, and then tie them on silicone bolsters. So 4 sutures, 2 on each side.
Adını söyle.
Cricothyroid membrane was close to
Birden 10'a kadar say.
voice pitch increases intraoperatively. That's her voice 1 week later. The voice is satisfactory early after surgery.
Şu anda çok iyi. Memnunum yani.
She is happy right now, but let's see.
25 yaşındayım.
The
Burada
pitch
yaşıyordum.
dropped.
Ev hanımıyım.
So I will perform web formation on her.
Bir tane kızım var.
Bolu'da yaşıyorum. Evliyim.
That's her voice after web formation. Now she is more happy, and this result is permanent. Dr. Kunachak from Thailand described a surgical procedure what he called thyroid cartilage and vocal fold reduction. In this surgical procedure, they removed anterior 1/3 of the thyroid cartilage together with the vocal fold and post-vocal fold. They sutured them to form a new anterior commissure. They reduced the size of the thyroid cartilage, shortened the vocal folds and post-vocal folds as well. Later on, this procedure was popularized by Dr. James Thomas from Portland, Oregon, USA, and he called this procedure feminization laryngoplasty. He added thyrohyoid approximation to this procedure as a difference. He published 94 patients. In his publication, pre-op fundamental frequency increased from 139 to 196, very good results. And this is a very good surgery. It's an open surgery, externally done. But the problem with this surgery is asymmetric tension on vocal folds. And he gave 33% revision rate due to this asymmetric tension on vocal folds. Due to this asymmetric tension, patients have diplophonia. I asked him, what do you do if such an asymmetric tension happens? He said, I do office laser tightening of the lax vocal folds. Laser-assisted voice adjustment was defined by Dr. Lisa Orloff from San Francisco, California in 2006. Shortly, we call it LAVA. You vaporize the epithelium and superficial lamina propria on the superior surface of the vocal fold. Here, there is a little decrease in mass because you are removing only the mucosa, and there is increase in stiffness because of scar formation. And there is little increase in fundamental frequency. He reported very high patient satisfaction rate. With such a low increment in pitch, you cannot get 78% patient satisfaction. This is the operative view in his publication. Superficial vaporization of the vocal fold with carbon dioxide laser on both vocal folds. Laser wounds should be symmetrical on both vocal folds. Otherwise, the patient will have diplophonia. My classmate, Dr. Ismail Koçak, he described laser reduction glottoplasty. Here again, we are using laser to reduce the vocal fold mass, but a much higher vocal fold mass is reduced here. We remove mucosa together with the underlying vocal ligaments, lateral half, and medial part of the vocalis muscle all the way down to the conus elasticus. Big trough of tissue is vaporized, and then we suture it, preventing granulation tissue formation and increase in mass of the vocal fold. By suturing, we are making the decreased mass of vocal fold permanent. We are tensing the mucosa, which also further increase the pitch of voice. Now, this is an operative video of one of my patients. I'm using carbon dioxide laser with 2 watt power with the smallest spot size available. Lateral half of the vocal ligament, medial part of the vocalis muscle are reduced down to the conus elasticus. Later on, I'm suturing the wound in order to make the decrement in the vocal fold mass permanent. The right vocal fold was sutured. Now the left, I'm doing the same thing on the left vocal fold, and it should be symmetrical on both vocal folds to prevent diplophonia. Again, the lateral half of the vocal ligament, together with the medial part of the vocalis muscle, down to the conus elasticus level is removed, and then the wound is closed with 2 sutures. These are 6/0 vicryl sutures, absorbable sutures, with the reverse cutting needle. This is the post-op view.
İsmim Dilsuan, İzmir'de yaşıyorum.
Transsexual.
23 yaşındayım. Sosyoloji okuyorum. Sesimin kadın erkeksi olduğunu düşünüyorum. Kadın bir dönüşmesini istiyorum. Merhabalar, ismim Dilsuan, İzmir'de yaşıyorum. Sosyoloji öğrencisiyim. 24 yaşındayım.
I published my experience on laser reduction glottoplasty on 28 patients in Annals in 2021. I gave 75% patient satisfaction rate up to 80%. Web formation, it was described as external procedure in 1982. Later on, the endoscopic procedures were described by Dr. Wendler. You are suturing anterior half of the membranous vocal folds together. We are shortening the vocal folds and also decreasing the mass of the vocal folds. The result is permanent. The only problem here is they can't shout. They can't scream. Okay? They complain of not being heard by other people in noisy environments. Okay, that's the main drawback. To solve this problem, the patient needs voice therapy. After suturing the vocal folds, I inject Botox to both vocal folds, 5 units to each vocalis muscle, in order to prevent sutures from cutting through the vocal folds, because vocal folds are mobile. So as they move medial and laterally, the sutures will cut through tissue. Dr. Kim from South Korea has the highest experience in the world with 83% satisfaction rate. He doesn't call his surgery web formation. He calls it vocal fold shortening and retro displacement of anterior commissure. Recently, Dr. Kim defined type 2 of his surgical procedure. In type 2, after having passed the suture through the vocal fold, he passes it through the internal perichondrium of the thyroid cartilage. He is tensioning the vocal fold anteriorly and inferiorly. He says type 2 gives better results than type 1. This is the intraoperative video. I'm removing the mucosa on the free border of the vocal fold at the anterior 1/2 of the membranous vocal fold. I do this bilaterally and symmetrically. Then I will start suturing. This is 5/0 vicryl again with reverse cutting needle. I want to keep the knot below the vocal folds in order to apply enough tension. Because you will see that a lot of tension has to be applied in order to bring the vocal folds together. It's not easy to make a web. You see, despite this high tension, this knot went loose. So I will compensate it with the second suture. So I made 4. There is 1 additional at the anterior commissure, 5 sutures.
23 yaşındayım. Ataşehir'de oturuyorum.
23-year-old transsexual.
1,5 yıldır bir ameliyat geçirdim. Transseksüel oldum ama sesimden çok
She has 120 Hz pre-op fundamental frequency.
Benim ismim İlmaz. İstanbul Ataşehir'den
That's her
geliyorum.
post-op voice.
Yaklaşık 2 ay öncesinde ses ameliyatı oldum. Kontrol
Now,
amaçlı.
She has
Bey'e ziyarete geldim.
205 Hz. I published my results on web formation in Journal of Voice in 2017. Pre-op fundamental frequency increased from 152 to 195. That's around 45 Hertz increment. That's what you usually get. 26% of my patients were not satisfied with the results, so I had to add laser reduction glotoplasty on them. So my patient satisfaction rate is around 74%. You see the post-op results of patients who were unsatisfied with the web result. So you have to go above 190 Hertz. Now the web and laser reduction glotoplasty combination. Another transsexual 20-year-old. So I performed web on her.
Demir, 20 yaşındayım, 94 doğumluyum.
110
Hacettepe
pre-op
Üniversitesi. Merhabalar.
after formation, it
Hacettepe'de
increased to
okuyorum.
180.
21 yaşındayım.
She wasn't happy about that. So I added laser reduction glotoplasty on her.
Adım 23 yaşındayım. Hacettepe'de öğrenciyim.
It became 220 Hertz. I published my experience on sequential glottic web and laser reduction glotoplasty in laryngoscope this year. I had 35 patients. After combination of these 2 procedures, patient satisfaction rate rose to 100%. As a conclusion, you should have at least 2 surgical procedures in your armamentarium in order to satisfy your patients. Thank you very much for listening.